Thank you, Speaker. And I rise to speak on the matter for public importance. And this government, the Andrews Labor government, has clearly got its priorities all wrong. To be prioritising a Box Hill to Cheltenham rail project when our health system is clearly in meltdown, where people cannot get an ambulance, where people cannot get a bed in hospital, where people cannot be seen by a doctor or a health professional when they need to. This here in the state of Victoria, I am in shock to this minute that this is where we have come to. And now I'm hearing that a government who came up with an idea that a $50 billion rail project from Box Hill to Cheltenham has now actually been shown by the Parliamentary Budgetary Office not to be a $50 billion project. No, for only 2/3 of it, it looks to be in excess of $200 billion. Now that's in the words of the Independent Parliamentary Budget Office. This is a project that the government and, well, Daniel Andrews, I'd actually suspect the Premier, sorry, Speaker, the Premier actually made up on the back of an envelope because even their own organisation, Labor's Infrastructure Australia, did not cost this and have actually said now that it is not something that, what they've said, is they want to look at projects with merit and take the politics out. This is a project that never went through that process. And whilst we have our health system collapsing, we, the Liberal Nationals, will take the money from that project that we will shelve and put it into our health system because that's the priority of Victorians. This is a state where the Premier said before COVID or as COVID began, I will prepare the health system. He said that and asked every Victorian to stay at home whilst he did that. Victorians did their bit. Did the Premier and Labor do theirs? I don't think so. This was a first-class health system in Victoria. It was one that I worked in for a very long time and I was very proud of it. But it is now broken. The system is broken. But what we do have is first-class people, first-class professionals, be they nurses, be they doctors, be they personal care attendants, ambulance officers, kitchen staff, cleaners in the hospitals, in the clinics out of the hospitals. The health professionals have been busting their guts, and they are first class, but the system that was first class has broken. And it's really telling, and it's trying every single one of them. The nurses that clearly talk to me a lot because most of them, most of my friends are nurses, and the burnout, the pain, the suffering in their voices when they speak to me, often actually debriefing. They want thank you through action, not words. They hear in this place the thank you, the hero. They say, we don't want that. We needed the resources that we're told we were going to get. Where did the 4,000 ICU beds go? They were promised. They were promised by the Premier. The hospitals, there were 10 hospitals promised in 2018 by this government prior to the last election as election promises. Only one has work started on that. Now, we've got the Maryborough Hospital that was supposed to be completed by this government in the first term. That has not even had the plans complete. So what does that tell me? It tells me that South West Healthcare, that is supposed to be complete by 2026, is at real risk of not being complete on time. Now, this is a hospital that should have been announced 5, 6, 7 years ago. It was announced in 2020, but those hospitals in 2018 haven't actually been started except for one. So I'm very concerned that the staff in South West Healthcare, those fantastic nurses and doctors working in extraordinary conditions in A&E, accident and emergency, I'm worried. Because I'm already hearing that people are getting treated in the corridors, that children presenting with lacerations can't get sutures, that elderly women, a lady and her 83-year-old sat on a trolley for in excess of 20 hours. And this is not the staff's doing. They are busting their gut. The system that we all were so proud of is absolutely broken. And announcing free university for the next 2 years is a great announcement that we have matched, but it's 3 months before an election. Isn't that pretty disingenuous? Shouldn't that have happened 2.5 years ago? Shouldn't that have been something that was obvious? We've got less people answering our ambulance calls than there were before the pandemic. Today we've got less people answering the phone to your call if you ring up and require an ambulance. Now, the reality is there were 16,000 of us medical professionals who've retired who the government put a call out to and said, can you come and help? Well, I tell you now, there's plenty of people like myself who would have been more than capable to be a call taker. We understand the medical language. We would have been easily able to be put through a systems education of how to do the decision tree process that you would need to know. But no, what happened to the 16,000 people who put their name down? It's all been just to look good with no follow through. You know, I feel so concerned for how my fellow nurses are coping. You know, I heard of the nurse who burst into tears in the corridor with the chemotherapy patient, the young man who'd sat for 27 hours. He would have been clearly immunocompromised and he hadn't even been given food. That's just the basics, and it's not the nurses, it's not the kitchen staff, it's the system. They are running ragged, and that is what happens when you are run off your feet. You can't possibly think of everything. The children I'm hearing about, one in South West Coast with a burst appendix who couldn't get a hospital bed at the Royal Children's Hospital. There were 19 people in front of this 5-year-old to get a bed first. This is someone who could go into shock and die. That is so serious a condition when you have a burst appendix. An infant I heard of recently, 5-week-old infant, presented to A&E with bronchiolitis, with a respiratory, using all the accessory muscles of respiration, the classic labouring breathing, with saturations of 92. That is low. That poor mother was told to go home by a nursing staff who were devastated to have to say this because they didn't have a bed, and represent if the child can no longer suckle because you can't breathe and suckle at the breast if you're exerting so much energy in trying to breathe. That mother came back 2 days later, or I don't even think it was 2 days, and that child had to have a tube put down its stomach to be able to feed, an nasogastric. That mother said the nurses were so upset that they had to deliver that message to that mum. The nurses were so upset. Another young nurse friend of mine said, it's no fun going to work anymore. It's just too hard. It's soul destroying. You know, the ambulances officers, they just want to turn up for the calls that they know are out there. When I drive to Portland now, back and forth to Portland, I pass an ambulance with lights on every single time. And these are ambulance officers who can't be at the cardiac arrest or at the motor car accident because they're transferring patients back and forth from Portland to Warrnambool. The system is broken and we need a government to invest in it, not in a rail service that is already blown out before it's begun in the costing, because it's not genuine what the Premier thought it would cost. He did it on the back of an envelope. That is clear for all to see. Not even their own organisation, Labor's set up Infrastructure Australia, is backing this. So we've got Portland Hospital. It's been crying out for help for years. A big industrial town with large industry and needing help. No doctors often in urgent care. Ambulance having to do airway support and getting patients across to Warrnambool. So where are the extra ambulances that the government would have had to have known they would need? Where are the extra ambulance officers and call takers that they could have trained up 2.5 years ago? The nurses who needed free university back then to encourage them. The nurses who have been working for 2, 3, 4 years in these conditions, they're the ones who needed help. And this free university would have helped if it had 2 years ago. The AMA warned of this way before COVID. The perinatal inquiry I was part of warned of the workforce shortages before COVID. 2017, I was part of that recommendations that were handed down. Not one recommendation, not one has been acted on. This is not COVID that they can hide behind. This is a Premier who said, I will prepare the health system and did not. I will get to 4,000 ICU beds and did not. This is a Premier who wants to build a rail project from Box Hill to Cheltenham instead of listening to Victorians. They are dying. I ring an ambulance now and I'm frightened that it won't come. I can't do it without an ambulance backing me up. I can't do it without a hospital with oxygen suction on the wall. Listen to Victorians and do what's right. Shelve the project.